So I grew up in the Pacific Northwest in Portland, Oregon, and went to med school at Loma Linda University in Southern California. And from there I did my residency at Geisinger Medical Center in Pennsylvania and my fellowship at the University of Colorado Anschutz Medical Campus in Denver. As a fellowship-trained adult reconstruction specialist in orthopedics, I'm able to bring with me a level of expertise to the mountain communities to allow patients to receive expert care closer to home in regards to hip and knee replacement. This allows me to tailor their care appropriately to fit their individual needs and activities that go along with living in a mountain community. I was drawn to Vail-Summit Orthopaedics because of the camaraderie of the team that's here. Not only is the location amazing, but the people that work here are amazing too. We have experts in all other specialties in orthopedics. We have great nursing staff, great support staff. And it really is a team environment where people enjoy working together to help the local community and help the patient. The most common conditions I'll treat in orthopedics are predominantly hip and knee arthritis, and that ranges from osteoarthritis to rheumatoid arthritis to post-traumatic arthritis. And my fellowship training has allowed me to gain the expertise to treat these appropriately. They range from primary total hip and total knee, from mild arthritic changes, to complex primary total joints, patients who have had significant surgeries on the joints before from trauma or other related surgeries, or patients who have deformity problems. I'll be able to take care of those. But predominantly I'll also be able to take care of the revision surgeries that come with this operation. Patients who have had joint replacements before that need a tune-up, that need a replacement again, I'll be able to take care of those patients. My philosophy of inpatient care has developed over my training. In training, we're taught not only how to operate, but when to operate. I think it's important to work with the patient to establish goals of care and expectations, and to treat those patients appropriately, whether it's a non-operative treatment option or a surgical treatment option. My goal is to work with the patient to get them to that next step in their activities. I got into medicine because I enjoyed working with people. I found out early on in my childhood that I really was attracted to helping others. It brings me great joy to help someone who's in need or who's hurting, to help alleviate their pain and their struggles, help them get back to a normal functional life as painless as possible. I knew I wanted to become a doctor when I was a kid. I grew up in a family of physicians, and it was kind of the family tradition. And I remember how grateful people were for my father and my grandfather for their training and their ability to help others who were in need. And I wanted to be able to provide that same level of care to others, to help guide them or to help treat them appropriately and get them back on their feet. I chose orthopedic surgery specifically over other aspects of medicine because I enjoyed working with the patient. I enjoyed working with the anatomy and the physiology of orthopedic surgery, muscles and bones. I enjoyed being able to witness patients firsthand do very well after surgery. Patients who have been unable to walk for years be able to get up and walk. And that's been a very powerful experience for me as a surgeon to help those patients. When I'm not at work, I really enjoy taking care of my family. My family, my wife and kids are the reasons I do this day in and day out. I grew up enjoying snow skiing and mountain biking and trail running and hiking and camping, and I enjoy teaching my kids how to do these things as well. That's really what I enjoy doing most now, is making sure that the next generation of my kids really enjoy the activities that my wife and I like to do. Our hobbies are such that we enjoy everything in the summer and winter months up here. And the community of people that are here, the patient population, the people I work with, also enjoy those level of activities as well. And I think that being able to balance a nice personal life here in the mountains with a professional life taking care of patients in the mountains is a perfect blend for my family and myself.